My name is Elizabeth Messenger. I am the Director of Outreach and Education here at NeedyMeds. Just a few housekeeping things before we do get started. You will all remain on listen-only mode for the duration of the webinar. If you do have any questions during the webinar at any point, you can type them into your questions bar in your control panel, and I will answer questions at the end. So again, anytime you think of a question, you can go ahead and type it into your questions bar in your control panel, and I will answer questions at the end. This webinar is being recorded and will be available on our YouTube page and eventually our videos page on our website within the next week or two. So you will be able to have a recording of it. And you can also email me after the webinar for a copy of the slides. So before we get started, I just want to get a feel for how familiar everyone is with the NeedyMeds website. So we're going to do a quick poll. And we're going to start now. How frequently do you use the NeedyMeds website? Select one of the following. I use it 2 or more times a week. I use it about once a week. I use it occasionally, or I am new to NeedyMeds. So please go ahead and start responding. Okay, I'll give everyone another second just to finish responding to the poll. And we'll go ahead and close it. Okay, so it looks like we have 46% of you who use it 2 or more times a week, 14% use it once a week, 22% use it occasionally, or you are new to NeedyMeds. So we have a pretty good mix, but we do have a good amount of people who do use our website regularly, which I'm not surprised since today's webinar is a little bit of a special webinar. This is our regular monthly webinar where I will be going over our website, talking about how to use our resources most efficiently to help yourself or help others. But as many of you have noticed, especially if you are regular NeedyMeds users, is we have updated our layout, our website layout. You probably got on the website this week and you were a little bit confused, but ultimately we hope that you're going to be happy with our new website layout. And as part of our webinar today, we will be going over some of the changes, making sure you can still find all of the help that you're looking for. So let's go ahead and get started. So the objective of today's webinar. So first and foremost, we want to familiarize you with our new website layout. It's important to understand that we haven't changed the content of the website at all. We really have just updated the layout, the navigation, some of the resource names, but all of the information, all of the resources that many of you use regularly are all still there, so you definitely want to keep that in mind. And ultimately, we hope that this has made it even easier for you to find the help that you're looking for, whether you're someone that uses our website to find help for yourself, or you're an advocate, or you're, or you're a nurse or a social worker, whatever you do. We do ultimately think this website layout will make things even easier. So why did we redesign the website? Many of you might be wondering. One thing we wanted to do was unclutter our homepage and our other pages on our website. We just wanted to really clean it up and make it easier for you to find things on our homepage. We wanted all of our resource links to be in one place, so many of you may have noticed that they're all along the top bar now rather than along the side, and we'll be going through that in a little bit. And ultimately, we just wanted to refresh our look. We hadn't updated our website in quite some time. We've been around for over 15 years, so we just felt it was time just to really give it a refresher and, again, make it even easier for people who use our website regularly and those who are new to our website. So a few changes and ways that we improved our website, some general improvements. We hope that we made it more intuitive for new users and regular users alike. So those of you who use our website, hopefully after you get used to it, you'll be able to find help even easier. And it was also important for us, for people who come to our website for the first time, to quickly be able to find the help that they're looking for, kind of have an idea of where to look. We wanted to make that simpler and easier to do. We did reorganize some categories of information, again, to make it easier and to quickly find the appropriate type of assistance. And we also improved the descriptions of our resources, again, especially for those new users to come and really understand right away what kind of help is listed in a particular section. Some specific improvements to look out for. So on our homepage, we now have announcements, so you're never going to miss a thing. Anything that new we're coming out with, you'll see them there. And in the slider on our homepage as well, you'll see different services we're offering and what's new. Our discount card and drug pricing calculator are now on more pages of our website, making it easier to find and utilize. We know our discount card is used a lot. We're saving people over $2 million a month now. We'll talk about our card a little more later. So we really wanted to be able to, people to be able to access it on a lot of different pages, as well as the drug pricing calculator, because we know people like to try to figure out their prices ahead of time when using our card. Finally, we did launch a toll-free helpline number in 2013, and we wanted to make sure people really know how to get to that number. So that's on our header now. So you can quickly find that number whenever you're on our website. You need extra assistance, so you just quickly want to find out what our helpline number is. That's always going to be in the header at the top of your screen. And again, just a reminder that you please type in any questions you have during the webinar, and I will be answering questions at the end. So I just want to remind you of that you will all be on listen-only mode for anyone who's just joining now. Okay, so who are we? We are a national nonprofit organization. We maintain a website of free information on programs that help people who can't afford medications and healthcare costs. More than 1.3 million patients, family members, healthcare professionals, social workers, and patient advocates, as well as many other people, use our website each year. And all of our information on our website is accessible online, at no charge, and without registration. So NeedyMeds was founded in 1997 by our current president, Dr. Richard Sagel, and a medical social worker, Libby Overly. When Dr. Sagel started the organization, he had 3 major goals in mind that we try to maintain to this day. He wanted the information to be free and anonymous to access, which it is. We don't ask any questions of people who visit our website, and the information is free to access. We hope that it'll be quick and easy to find, which is especially was our goal with our new website layout, making it even quicker and easier to find information. And he also wanted the information to be accurate and up to date. This is very important to us. The majority of our staff spend their time making sure all of our information is up to date, researching new programs, making sure that it's accurate for the many people who use our website each day. Okay, so we are going to go ahead and launch into some of the resources available on our website. We will be going through the website live in just a moment, so you can see the resources we list if you're new to our website, and also the changes in the layout that we've made. So we're going to start with prescription assistance. The patient assistance programs that we list on our website are sponsored by the pharmaceutical companies. They provide free or discounted medications for those who qualify. Unfortunately, there are no rules when it comes to patient assistance programs. Eligibility and application requirements vary program to program. Eligibility is usually based on insurance and income level, but they are going to vary. One thing that sort of runs streamlined through these programs is the doctor does need to provide a prescription to the patient and usually sign the application as well. These programs are for prescription medications. So the healthcare provider does need to be involved in the application process. Okay, so with that, we are going to go ahead and bring up the website. Okay, so this is our new homepage. Maybe some of you have seen it. Maybe you've been to our website, but this is your first time seeing our new layout. And as I mentioned, we have all the same content and the same resources. They're just a little bit reorganized and hopefully easier to find ultimately. So here we are on our homepage. The first thing you're going to notice if you are a regular NeedyMeds user is all of the information is now along the top here instead of along the left-hand side where it used to be. We used to have information along the left-hand side and at the top, so we thought we would condense it, put all the information on the top, so again, it was just easier to understand the different categories of information and where to find it. So in order to get to most of our major resources, you're going to put your mouse over this patient savings right here. and you'll see a drop down of all of the categories, all of those resources that you're used to using regularly. So we just talked about the patient assistance programs. Many of you probably just go straight to the brand name drugs list when you're looking up help maybe for yourself or for a client or patient, and again, you can still do that here. So we are going to go ahead and click on brand name drugs. If you're new to the patient assistance programs, most likely you would be looking up these programs by the medication someone needs assistance for. So that's what you would either want to click on the brand name drugs or the generic name drugs right there, depending on what name the medication you knew. So we're going to scroll down here. You can see here that the medications are all listed alphabetically. You can see this A through Z bar. So you're going to want to click on the name of the first letter of the drug that you're looking for to get to that. We're going to stay on the A's here, and I'm going to go ahead and click on Abilify. Okay. So these pages do look a little bit different than they used to, but again, it's the same information, just slightly reorganized. You can see here right at the top, it says program 1 of 2. Scroll down to see them all. So that means that we've found more than one program for this particular medication. You really want to scroll through all of them to see which program you or someone you're helping might qualify for. One thing you want to keep in mind is that we do list programs from most assistance to least assistance. So if there might be, we might know about a discount program or something like that, and that'll be more towards the bottom. So we will list the programs at the top that provide the medications for free, and then you can scroll down and see other programs. Okay, so the first thing you'll see is the name of the program here and their contact information. You can see it's run by the pharmaceutical company Bristol Myers Squibb. Here is a link to an application. This is actually going to be an interactive PDF that you can fill out mostly online and then print out to get signatures. Again, they usually require a doctor's signature as well as the applicant's signature. Here's the medication we just clicked on, the Abilify. The first thing you're going to want to look at is the eligibility requirements. So again, like I mentioned before, these programs usually base their eligibility on insurance and income level primarily. You can see here the patient must have no prescription coverage, and they have to be at or below 250% of FPL. FPL stands for federal poverty level. Now, if you're working with someone and you know their income, you're not sure what that translates to as far as federal poverty level, you can go ahead and click on the FPL income calculator and quickly find that out. So we're going to click on that. You can see here again, this looks a little bit different, but it's the same calculator we've had on our old layout of our website. I'm going to put on someone's income. Let's go 60,000 yearly for a family of 4. Let's calculate. So this person would be at 268% of the federal poverty level. So they would actually just be over this guideline. But one thing you want to keep in mind with the patient assistance programs is that they will sometimes make hardship exceptions, especially if someone maybe is just over the eligibility. So you always want to call the program and double check when you're in doubt to see if someone can get enrolled in a program. So the next category you're going to look at is the application. Find out how you get it, what the applicant needs to do, what the doctor needs to do, and the timeline. Programs do usually take about 2 to 3 weeks to get enrolled in, so you do want to keep that in mind. You always want to make sure the application is filled out completely as you can, so that that won't delay the process at all. The last column you want to look at is the medication. See how much is sent, where it gets sent to. Sometimes the program will send the medications to the doctor's office, sometimes to the patient's home. Again, it's going to vary. And usually programs do require that the applicant reapply every year, sometimes every calendar year. So that means they have to fill out the paperwork every year. You always want to look at the additional information section. That's where we're going to put things that don't necessarily fit into the bullet points. So we're not going to look through this program too closely, but you can scroll down and look through that. And then when you're looking for help for someone or for yourself, you always want to look through all the programs and figure out which one they qualify for, and maybe call multiple programs to make sure you found the one that will provide them the best assistance. Okay, so we're going to go back and go back to this patient savings. So one thing that you want to keep in mind is you can also look up a patient assistance program alphabetically by clicking on program name list. One thing you want to keep in mind, if you look up a program by the name of the program rather than by the medication, is you're going to see all the medications that program covers. So we were looking at the Bristol-Myers Squibb program, and you can see here that actually, in addition to Abilify, it actually covers a few other medications as well. So you just want to keep that in mind. All the rest of this information will be the same, but if you do want to check to see if a program covers more than one medication, you do want to look it up alphabetically by clicking on the program list. Okay, we're just going to go back. You can also look up a program by the pharmaceutical company by clicking on company name list. And again, you can see here for those of our regular users that these are all the same categories, same resources on our website. Again, just a little bit differently organized. So here you can see all the pharmaceutical companies. You might notice that some of these have no active programs and they're not an active link. We leave those there as a heads up to you that either a program has closed or we called the company and they never had a program. So we just want to save you the time of doing research. That's why we leave those there, and that's what that means when you see that. Okay, so if we keep looking under prescription assistance, finally you can click on program applications. These will bring you straight to the patient assistance program applications. If you already know the name of the program, maybe someone's just reapplying, you can do that. This date right here is the last time that we updated it. So you can just take a look at that if you're trying to find out if you have the most updated application. And if you see a new button, that means that we just uploaded a new application. They just came out with a new application. One thing you want to keep in mind with patient assistance programs and their applications is that they do change frequently. Applications change frequently. They'll add or drop medications, especially this time of year in January. A lot of programs might be changing. They might be adding medications. They might be taking medications off their program. So you always just want to come back to our website, make sure that you have the most updated information. And you can always let us know if you think we don't have the most updated information. You know, we really depend on our users just as much as you depend on us. So if you ever see something on our website you think is out of date, should be added, you're going to see a Contact NeedyMeds on almost every page. And you can always click on that to get the email address and email us. You'll also have my email address and a general email address at the end of this webinar, and all of those emails are checked most every day. So you can see here there's the Contact NeedyMeds on this page if you thought an application was not up to date for some reason. Okay, so that is the overview with the pharmaceutical patient assistance programs. In addition to those programs, we have a lot of other resources and ways you can save on your healthcare costs listed on our website. And while many people use our website a lot, sometimes they just go straight to our PAP section and don't know about all of our other resources. So that's what we're going to go over now. So we're back under patient savings, and we are going to go to help with prescription assistance applications. This was previously just called application assistance, so you may know it as that, but you can see right here we still left part of that name. These are groups and programs that actually help people apply to patient assistance programs, fill out the paperwork. If you do this kind of work yourself, or maybe you're new to NeedyMeds and you can already tell that it can be a little bit confusing, a little bit overwhelming for folks, especially if they're not comfortable using the internet, getting enrolled in these programs. So these are groups that we found that'll help people you know, navigate that process. We try to make it really simple, but these groups will even go that step further. So you can either put in a zip code and search up to a 20-mile radius, or you can click on a state and see all the programs in a state. So I'm going to click on Florida, and you can see here all the programs in Florida. You can see the name of the program, who is helped, and it's going to be listed alphabetically by city as you scroll down. Okay, and then again, you see that Contact NeedyMeds page. So that's going to be on all of our pages. Whenever you want to get in touch with us about something you think needs to be updated or isn't right or anything, any questions, you can contact that. Okay, back under patient savings, we're just going to keep going down these different categories. We get to free, low-cost sliding scale clinics. So currently we have over 13,000 clinics listed in our database. These are going to be facilities that we found that either offer their services free, low cost, or with a low cost with a sliding scale based on income, meaning they'll reduce their cost based on someone's income. You'll see again the similar map. You can click on a map, click on your state to see all of the clinics in your state. You can also put in a zip code to find all the facilities nearby to you. So let's go ahead and put in where we are, which is in Gloucester, Massachusetts, north of Boston. And I'm going to put in 15 miles. Okay, so we know about 13 clinics within 15 miles of the NeedyMeds offices. Just scrolling through here, you can see that we have the name, the eligibility, and the services. These won't necessarily just be medical services. They might be dental, women's health, STD testing, all different kinds of things. These facilities are going to include free clinics, federally qualified health centers, and again, other places that will discount their prices. If you do want to print out a list, maybe you're working with a client and you want to give them a list of clinics as they leave, you could either check the ones you want to print and then press print, or you can press print all to get the full list. Okay. Next we're going to go to coupons, rebates, and more. And I do just want to pause and say, if you are new to our website, this may feel a little bit overwhelming. We do have a lot of information on our website. So I would encourage you to kind of come back on your own and look through it. I'm going to guide you towards our YouTube page and our video page, which has videos going over our resources. One thing you also might notice is this little thing here. If you click on that, that'll actually bring you to a video recording of our president talking about our various resources. So we have the appropriate videos on each page. So if you clicked on this, this would be a video going over some of our additional resources like our coupons. So that's a really good thing to use as well. And you'll also have my contact information at the end. We have our helpline number. So, you know, again, if you're new to the website, just kind of try to absorb as much as you can, and I'll point you to some resources if you still have some more questions. Okay, so coupons, rebates, and more. This is a section of our website where we list coupons on prescription medications as well as over-the-counter medications. So it's a great place to look if you need help on over-the-counter. It's also a great place to look if you need help with the assistance, you need help with the cost of a copay. We list copay cards in this section as well. So the coupon is going to be listed alphabetically by the name of the medication. You can see here the name of the medication, if the offer expires, what the offer is. The manufacturer's offer is a link that'll bring you the closest we can get you to either signing up for the coupon or printing it out. And again, you'll see this A through Z bar on most sections of our website, so you'll always just be looking at the program or a medication alphabetically. You may have also noticed when we were on the brand name drugs list, a little coupon right here, view coupon. So whenever you see that next to a medication, that's just a heads up to you that there is a coupon available. We would still encourage you to click on the name of the medication like we did before and look at the patient assistance programs, because getting your medications for free or very discounted is always your best bet. But maybe if you don't qualify for that program or you do need some quick assistance, you can click on the coupon and that'll bring you right back to our coupon section. Okay, so next we're going to go to diagnosis specific. So this is a little bit reorganized. We tried to put all of our diagnosis specific resources all in one section. So we are going to start with our diagnosis-based assistance programs right here. Okay, so these are programs that we've found that'll help people with various costs of health care. Many people struggle not just with the cost of medications, but a lot of costs associated with a particular disease, whether it's travel costs, supplies, equipment, testing. There are a lot of costs people need assistance with. So this is the section of our website you'd look for that kind of help. Most likely you'd be looking up what we call DBAs for short by diagnosis. So you can click on the by diagnosis button here. You could also have done that right at the start, right up here. You could have started by doing search by diagnosis. So here you can see the alphabetical list. And again, that A through Z bar you've seen in other parts of our website. I'm going to click on D and look at diabetes. Okay, so here you can see at the top we have some other suggestions of categories of information to look under. We have some more specific categories of diseases and some more general, so we put other suggestions of categories to look in if you can't find the help in the category that you've clicked on. So you can scroll down and sort of see the various programs we have listed. You're going to see all of the national programs listed first, with all of the programs listed alphabetically by state as you scroll down. And you can see just even looking through these, it's not just the medications, it's testing. This one helps with durable medical equipment. This one helps with testing, travel expenses. So there really is a lot of help out there. It's really just knowing where to look for it. And then, like in most sections of our website, clicking on the name of the program will bring you to more information. Okay. I did mention that that was one way to look up these programs. If we go back to our drop down here, you can see that you can also look them up by area of service, as well as alphabetically by the name of the program. Okay. Next, we're going to go to disease information pages. And again, I just want to remind everyone that if you're having any questions, you're confused about anything, please type in any questions you have into your questions bar in your control panel, and I will be answering questions at the end. So just go ahead and do that when you do think of a question. So previously, these disease information pages were called disease resource pages. So that might be what you're familiar with from our old site. They are the same pages, just called a little bit different and set up a little bit differently. So let's go ahead and click on liver disease. On some of these pages, we've worked with another disease-based group. Some of them we've put together ourselves. Either way, they're going to have information about the particular disease. On the right-hand side, you're going to have links to more information and resources in this box right here. If we scroll down, you can see the list of medications someone might be taking who have that diagnosis. And at the bottom, this is actually going to link you to the diagnosis-based assistance programs for that particular disease. So that section of our website we already looked at. What's really helpful about these pages is if you are, maybe someone comes in that you're working with a client who needs a lot of help for a particular diagnosis, instead of clicking around our website and looking for all the different kinds of help, you could see if we have an information page for it and quickly find all the help that's available. And especially with the medications, if they're taking several medications, instead of looking them up each individually in the brand name drugs list, you could go to the page and you can see here that these will actually link right back to any patient assistance programs we know that's available. So they are a really good resource, and they're a good page just to start on if someone needs a lot of help associated with a particular disease. Okay. So we also have, I'm not going to spend too long on this, we have diagnosis-based camps and retreats, as well as you can see here diagnosis-based scholarships. So if we click on camps and retreats, you can see here that you can look them up in 4 different ways: by diagnosis, by camp name, by camp sponsor, and by camp location. One other thing you might notice is this add a program information form. Those are also on some of our other pages as well. That's meant for organizations that actually think their programs or resources might fit in that particular category of information we're providing. So if you perhaps run a diagnosis-based camp and you want us to list it, you can click on this and it'll bring you to a form that you can fill out and will get submitted to us, and then we can add your camp or retreat. So you might notice those forms on some of our other pages as well. And like I mentioned, we really do depend on our users. So please let us know if you do run an organization, run a program we're not listing that you think we should be listing in a particular place. So I'm going to go ahead and click on diagnosis just so you can kind of see what kind of help we have. I'll click on ADHD. So we know about 60 camps for people with ADHD. These camps are also going to be for children and adults with specific diagnoses and disabilities. Also children with family members with a specific diagnosis. So you might be able to find a camp for someone who has a parent with cancer, something like that. You can see here a summary of the camp, where they accept campers from, and the camp location. And again, clicking on these names, it's always going to bring you to more information about that particular program or resource. And again, here you see that contact NeedyMeds page, NeedyMeds link if you do want to email us about anything you think is incorrect or should be added or updated. Okay, and I did mention we also have the diagnosis-based scholarships. I won't go too into these, but they are scholarships offered based on someone's diagnosis that you can look up by diagnosis, by residency of applicant, or by scholarship name. Okay, so we're still in patient savings. We also have a list of government programs. I'm going to click on that. We have a list of the state-sponsored programs, Medicare information, and Medicaid sites. We have a list of the SHIP sites, which are the federally funded health advisory programs. that provide health insurance counseling to Medicare recipients. And we also already talked about the federal poverty guidelines, so you can also find more information there, as well as tax return request forms. Okay. A few other resources that we offer. I want to actually pause. So far, we've talked about a lot of different programs and resources that we list on our website. We don't actually run any of those programs, but we're sort of like the yellow pages for all different kinds of programs and resources that can help you with your healthcare costs. Now, in addition to all of what we've talked about so far, we do have a few resources that we do offer ourselves that we're going to talk about now. So that's right here, additional resources to lower costs. We have an MRI CAT scan discount that we work with another company to offer. So you can get a 50 to 75% discount on your imaging services if for some reason they are not being covered by insurance. You can see here how you can get that discount, either call a number or fill out a form online. And the discount's accepted over 2,500 providers nationwide, so it's a really great thing to know about. And we also have a medical bill mediation. So we're working with another company to offer this as well. If you have $1,000 or more of unpaid medical bills, this company will work with you to get those bills reduced. There is an upfront fee, but they will refund that fee if they're not able to save you any money. So you can actually call us to get that process started, and we'll screen you and then send you on to that company. So the last thing we're going to talk about is our drug discount card. But before we do that, I kind of wanted to walk you through our website a little bit more, talk about some other things we have available, and some other changes we've made to the layout. Okay, so if we go to our advocates page, you can see we have 3 different categories. We have resources for you, education, and partnering with NeedyMeds. So if we go to resources for you, we have a great new subscription center. So a lot of you might subscribe to some of our newsletters, maybe our newsletter, maybe our PAPIS, which is our Patient Assistance Program Update Service. And this is a way where you can sign up for everything you want all in one place, or check which one you want, or if you're interested in partnering with us. So it's called our Subscription Center. You can look at that. So let's go back. So I just mentioned PAPIS, which is what we call this service for short. That's a great thing to sign up for if you're not already signed up. It's a free weekly or daily email with all the changes that we've made to the patient assistance programs. And if you are an advocate working a lot with these programs, it's great just to get that email and know what's changing when you're working with people, helping people get enrolled in the programs. So you can order print materials as well. We have our brochures and our direct discount cards. We send out packages of those all the time. We also have our patient assistance program software, PAP Tracker. This is ideal for an organization that helps a lot of people apply to patient assistance programs. Maybe if you're doing it all by hand now, it can get a little overwhelming. So this is the software that will save patient and doctor information, automatically fill out applications pulled from our website. So that's a great thing to look into if you are doing a lot of application assistance, and you can click on this to find out more information about that. Okay, so if we go back to this advocate, we do have a lot of educational opportunities. You're already all on this webinar, so you know about the webinars that we do. We do these webinars monthly, going over our resources. We also have special topic webinars that we do regularly as well. Next one we have coming up is next week. This is about a new project we're launching soon called Heal Thunder. So you can read all about that. It's an exciting new NeedyMeds project, so I would definitely encourage you to sign up for that webinar, which is coming up next week. All of our webinars are always free. Okay. And I already mentioned our newsletter. I don't want to spend too much more time, so I do want to leave time for questions. You can also partner with us by going to here for more information. We partner with other people on our drug discount cards. You also saw that we partner with other disease-based groups on our resource pages. And in general, we're always open to collaboration, so you should always get in touch with us if you're interested in working with us in any way. The Getting Started drop-down is also a really good place to look. We've revised our new users page so that if you are new to our website or you want a refresher, this is a great place to look. Sort of a summary of all of the resources we have to offer, kind of what we talked about today. So that's a new page on our website. We also have our video library as well as our YouTube page. if you go there, you can see recordings of the webinars as well as the short videos that our president recorded going over our resources. So again, you can go to our YouTube page, the link's up here, as well as our video page for that. And we also have our helpline. I mentioned that a little bit earlier in the webinar. We did start offering this in 2013, and we just really want to make sure people know about it. It's a toll-free helpline for those who need some help using our website. We'll either walk you through our website or we will look up information for you, look up phone numbers, things like that. So we do want to make sure people know about that because we only started offering that toll-free number last year. And you can also see that's also right here I mentioned on our top of our page. That's always there in case you quickly want to find the number. Okay, so I think we'll kind of start to wrap up. A few other things. You may have noticed that we've been working with consumer reports. You can see right here. Next to some of the brand name drugs, you'll see the View CR article. So we're working with consumer reports to provide more information about particular medications. So if you see that listed next to your medication, you can click on it for information provided by consumer reports. You'll also notice, as I said in the slides, that we have our NeedyMeds drug discount card and drug pricing calculator on this left-hand side. Stays there throughout most of the pages. So you can click on that to find more information about our card, or you can click on the drug pricing calculator to calculate prices using the card at a pharmacy. And we also have our two apps. Our drug discount card is an app. We also have the NeedyMeds Alert. That's an app that you can use to, it'll help you remind you to take medications as well as have some NeedyMeds information as well. Let's go back to our home page now. So you can see here, this is where we're going to be putting announcements, and we have different things going through here, different projects that we're working on. And we have all of our social media right here. We have a link to our blog right there, and if you haven't been near our blog, you should check it out because there's some really great articles on there that we come out with. And I think with that, we are going to go back to the slides. Again, any questions that you have, we are going to be wrapping up soon, so please go ahead and type those into your control panel. Okay. So I mentioned that we will be ending with the drug discount card. I'm just going to talk a little bit about how that works, and we'll summarize, and then I will answer questions. So this is a free card we offer. It can save you up to 80% off the cost of medications. You can use it on prescription medications, over-the-counter medications and medical supplies written as a prescription, as well as pet prescriptions you can purchase at a pharmacy. There's no set list of medications. You can try it on any medication you can't afford. How does it work? There's no activation or registration needed. It never expires. There's really no residency, income, or insurance guidelines, and it's accepted at over 63,000 pharmacies, including all of the major and local chains. So basically, you just need to bring it to the pharmacy along with your prescription to save. So who can use the card? It cannot be combined with insurance. This means that anyone who's uninsured could use the card on anything they can't afford. If you do have insurance, whether it's public or private, you can use it instead of your insurance if you have a medication not covered, you're in a coverage gap, you have a high copay or deductible, you can use the card instead. They just can't be used at the same time. So you would go to the pharmacy and say, I want to run my medication through the discount card instead of through my insurance. How do you get one? Well, you can go to our website and print a card out, and that piece of paper is just as good as a plastic card. You can send us a self-addressed stamped envelope, and we'll mail you a plastic card back. And as I mentioned, we do send out packages of our materials all the time. So if you wanted to get a supply of our brochures and drug discount cards, we could send you those out. We also have our brochures available in English, Spanish, Portuguese, Russian, and the Cambodian language Khmer. So we have some language options as well. Okay, so that was a lot of information. Especially if you are new to our website, you may feel a little bit overwhelmed. So this is a little summary for you, just so you can kind of wrap your head around all the information we've talked about. So first, did you look for a patient assistance program for the medication? That's always what you want to start with because getting someone's medications for free is always your best bet. If there wasn't a patient assistance program, someone needed quicker assistance, help on an over-the-counter, Did you try the drug discount card? Remember, you get the medication, the over-the-counter written as a prescription. You can use the card, or you could check our coupons, rebates, and more section. If there wasn't a patient assistance program, maybe the person that you're helping needed quick assistance or help with the cost of a particular diagnosis, you could look at the diagnosis-based assistance section. Okay, so contact information. If you're interested in working with us in any way, or you'd like a copy of the slides, specific questions about this webinar that I don't get to, you can email me, elizabeth@needymeds.org. If you have questions about our new layout, if you're still a little bit confused, you're still not sure where that one page that you always went to was, you can email webmaster@needymeds.org, and we will guide you to the answers. Or in general, if you have any comments about our new layout, we do really want to hear from you. We really did this to make it ultimately easier for you, so please let us know anything you want to share with us. And general inquiries, you can always email info@needymeds.org. And I mentioned our helpline. It is a bilingual helpline, so we have English and Spanish speakers. And we are staffed 9 a.m. to 5 p.m. Eastern Standard Time, Monday through Friday. You can always leave a message, and we'll call you back. And that number is 800-503-6897. And that's it. There will be a survey when the webinar ends, and we'd really appreciate you fill that out, not just for feedback on the webinar, but also, again, feedback on our new layout. We want to keep improving it, keep working on our website, keep making it better for our users, so we want to hear from you. Okay, so I'll go back to the contact page and leave that up, and we'll start answering questions. So please type in any questions that you have, and we will start answering them. So there's a question if there's the standalone income calculator. Really, at this point, they are all pop-ups, so you'll want to go to a PAP listing and use one of those income calculators. I think that will be your best bet. I'm just reading through some questions, so give me a minute. There was a question about the pricing of PAP Tracker. You will want to either get in touch with me or go on the PAP Tracker page for information about that. It is based on how many applicants you have using the software or how many applicants you're helping using the software. But we do have a 30-day free trial available, as well as grants for nonprofit organizations. So if you're interested at all, I would encourage you to either get in touch with me, or again, you can go to the PAP Tracker page and contact the person that handles it through that. And they'll walk you through the software and give you a lot of an overview of it, so you can decide if it's right for you. The question if our discount card can be used if they're waiting for approval for Medicare and Medicaid, or someone's waiting for approval. The card can really be used anytime, whether someone has Medicare or they're waiting for Medicare. They can always use the card to buy a medication, whatever insurance they might have. They would just want to go to the pharmacy and say that they want to run their medication through the discount card instead of any insurance they might have. Or if they don't have insurance, it's certainly a great time to use it. So like I mentioned before, there are no set list of medications the card covers. You're going to want to bring it to the pharmacy, find out. You bring it to the pharmacy and find out what the discount is. We do have the price calculator on our website, so that's not going to be a guaranteed price, but if you want to get an estimate of what your medication would cost using our card, you can also use that. Sorry, just reading through some questions. There's a question if you can use the card if your prescription is not covered under your insurance. That's a great time to use it. Again, just go to the pharmacy and say you want to use your card instead. It's a question about whether coupons are based on someone's income. That's really going to vary from the coupon to coupon or copay card to copay card. So those are all put out by the companies making the medications, and they're all going to sort of have their own guidelines, and that's when you're going to want to click on that link to kind of find out more information. Okay, just reading some questions. says, are vitamins or supplements covered by the discount card? Again, if they're written as a prescription, you can try using the card. You know, we can never guarantee a discount. It's going to be anywhere from 0 to 80%, on average 45% off the cash price, but you would want to have the doctor write the vitamins or supplements as a prescription, and you could use the card to get a discount. Again, any questions you think of, just go ahead and type them in, and I'll try to get to a few more. For those of you who might have joined later in the webinar, a reminder that you can email me for a copy of the slides, and a recording of this webinar will be on our YouTube page and our video page as well within the next week or two, so you can check that out. There will be a recording of this webinar. So someone asked what happens if a particular diagnosis isn't listed. Maybe you're looking in the diagnosis-based assistance programs and you can't find a diagnosis. You do want to kind of look around. As I mentioned, we have some more general and some more specific categories. We do have a very general category that's chronic life-threatening diseases. You could look there to see if there was help available. So you kind of want to look around because we have very specific categories and very general. So maybe your very specific type of cancer might not be listed, but maybe you can go to Cancer All and find help that way. And again, if you're ever confused or you're not sure if there is a resource available for the kind of help you need, you can always call our helpline and someone will assist you. You can always email us, info@NeedyMeds. That email gets checked daily. Okay, please keep typing in questions. I think we have just a few more minutes. Okay, it says, can we call the helpline to get the discount card? You can call the helpline to get a discount card. You can also, again, print one out from our website or send us a self-addressed stamped envelope. Any way you contact us, you can pretty much get a discount card. We will get one out to you. You don't need to have a brochure. When we send out our brochures, we also send out our drug discount cards all at once, but you just need the card itself if you're handing it out to people who need assistance to get the discount. The brochures just explain a little bit about how they work. And remember, you can also print out a card from the website. There's a question about, I think, kind of who can write out a prescription. I think this question is about for patient assistance programs who can sign the application. And generally the rules with that is, now each company is going to have different guidelines, but generally it's whoever's prescribing the medication. So if it's not, an official, if it just needs to be the healthcare professional, the person prescribing the medication that signs the application is usually the rule with that. And again, it's going to vary company to company, but that's usually what you can do. Question about how to request brochures. You can email info@needymeds.org to request brochures, and then you can go to that subscription page that I showed you a little bit earlier to request order print materials. There'll be a link that says order print materials, and you can do it that way as well. Or it's really simply just email info@needymeds.org. You give your address and how many you want, and we'll send those right out. Or you can email me if you want to talk to me. So it's a question about how our programs interact with Medicare Advantage plans. It's generally important to understand that, we don't, as I mentioned before, we don't run these programs. Most of these programs are just information that we list on our website, and each program is going to be different. Each program is going to have guidelines based on someone, if they can have Medicare, if they can't, if they can have a Advantage plan, if they can't. So it's really going to vary. There are programs and resources that help people who do have Medicare, and then sometimes you can't have Medicare. So you want to really think of us as the yellow pages for all different kinds of resources that, unfortunately, not as simply can have all different kinds of eligibility as well. Okay, I'm just going to look through these questions. I don't think we have much more time for any more, but if you do have any more questions, you can email me and I will answer them. And if I didn't get to your questions, we will look through all of them after the webinar and try to get back to you. So I hope this was really informative for all of you. Again, I just want to say to our regular users that were maybe a little bit surprised when they woke up and went on our website the day that it changed, we really do hope that ultimately it's better for you, it's better for our new users, it's better for everyone, and that you can really easily find the information you're looking for. That's ultimately our goal. We want to make it as easy and as quick for you to find your help, because ultimately that's what we want to do. We want to help people find assistance with their medications and healthcare costs. So with that, I think we're going to wrap up the webinar. There will be a survey when this webinar closes that'll pop up, so I really would encourage you. That'll help us please give us feedback on the webinar itself as well as on our new layout. It'll help us a lot. And please stay tuned for future webinars and attend our webinar next week. And again, remember, you can email me for a copy of the slides, and a recording of this webinar will be on our video page and our YouTube page in the next few weeks. So thank you very much.